First, I wish to thank Senator Michael Bennet for his outstanding service to Colorado. I urge you to vote for him for U.S. Senator. I am Dr. Warren Hern, and I'm director of the Boulder Abortion Clinic. Boulder Abortion Clinic is my private medical practice, which I opened on January 22, 1975. In 1973, I was the founding medical director of the first private nonprofit abortion clinic in Colorado, which began seeing patients and helping women in November 1973. I grew up in Colorado, and I know the people of Colorado. As a public health physician specializing in outpatient abortion services in Colorado since 1973, I am deeply concerned about the wave of cruel and repressive anti-abortion laws passed by Republican legislatures all over the United States. I am horrified by the U.S. Supreme Court decision overturning the Roe v. Wade decision. This decision sets American women back a century or more. Pregnancy is not a benign condition. Women die from being pregnant. Every woman who is pregnant is at risk of losing her life because she is pregnant, whether the pregnancy is desired or not. Complications happen in pregnancies that are an immediate threat to the woman's life, and she must have immediate access to the best medical care available. This sometimes requires ending the pregnancy without delay by physicians who are skilled, experienced, and ready to perform this operation to save the woman's life. For example, if a woman's water breaks when she is 18 or 20 weeks pregnant, there is no hope she will have a living baby, and she can die from an overwhelming infection in her uterus in a matter of hours. This is an emergency, and the uterus must be emptied immediately to save the woman's life. There are many tragic examples of women dying like this because they were denied an abortion. 30 years ago, I performed an emergency abortion at 3 a.m. in the hospital operating room to save the life of a woman who came to me to end a desired pregnancy because of a genetic condition in the fetus that caused a potentially fatal, uncontrollable rise in her blood pressure. She would have died without my help. These decisions are between the woman and her physician. They are not the province of politicians or legislators. Safe abortion is a fundamental and essential component of women's health care in the 21st century, and it should stay that way. This has been true for over 50 years in the United States. No woman's life or health should be at the mercy of the next election, her zip code, Mitch McConnell, Donald Trump, or Joe O'Dea. Joe O'Dea voted for the Proposition 115 in 2020 that would have made abortion illegal after 22 weeks in Colorado. This would have endangered the lives of many women in Colorado. O'Dea voted to close my medical practice, where I help women whose lives are endangered by their pregnancy. O'Dea opposes the Colorado Reproductive Health Equity Act that protects the rights of Colorado women to have safe abortions. He wants a national ban on abortion and would support appointing anti-abortion justices to the U.S. Supreme Court. O'Dea is in tune with the national Republican policy of opposition to safe abortion. The Republican Party has officially opposed safe, legal abortion since 1980, and it has used the abortion issue to gain power since 1974. O'Dea is a typical Republican politician who will step on the bodies of women to get power. He says he is pro-life, but he is not in favor of women's lives. He is against the lives, health, dignity, and safety of women. Joe O'Dea's votes, philosophy, and position on abortion endangers the lives, health, and futures of all women in Colorado. When he says he is pro-choice, he lies. Say no to Joe.